Many people believe too much cleanliness, being too clean, can be bad for us. The theory goes we need to be exposed to some germs to build up our resistance to disease and infection. But a new report has debunked this as a myth. The Royal Society of Public Health says it's fueled key misconceptions which could be risking our health. Its findings show 23% of adults believe hygiene in the home is not important. They also found in some areas men's attitudes to hygiene were worse than women's, with 16% of men saying it's not important to wash their hands after going to the toilet, and 8% saying the same thing when it comes to handling raw meat. Here with me now is Dr. Lisa Ackerley, a food safety expert with the Royal Society of Public Health. Thank you very much for joining me. Is it ever okay not to wash your hands after nipping to the loo or handling raw meat?
No, it's really dangerous, and what we're saying is that we must make sure that at targeted times we actually practice good hygiene, and that would be always after going to the toilet, because even if you think you're the cleanest person in the world, you might have touched things in the toilet room which could have contaminated your hands. And after handling raw meat in poultry, you could have contamination and then go on to spread that into other parts of the kitchen or even the home. And some contamination, for example Campylobacter, can be infectious in such low doses that just a small fingerprint of contamination could be enough to make you ill.
It's gone wrong a bit, hasn't it, with these key misconceptions, as you say. What should we be teaching our children so that we do move away from this things can be too clean?
Well, I think one of the most important things is to go back to basics and to get children to wash their hands. And I would say when they come in from school or when they come in from the garden, those are key times to actually wash their hands. And obviously before they eat, because otherwise they could be ingesting harmful bacteria. And people want to have a mixture of good bacteria and bad bacteria. So there have been this problem, that this myth that we need to actually not wash our hands at all, which is really, really dangerous, because what we actually want to do is focus on how we can prevent infection. And that's really so important, especially in an era where we've got antibiotic resistance. So we may not even have a second chance.
Yeah, the problem is most of us don't have a medical background, so we're talked to about good bacteria and bad bacteria, and it becomes very confusing. What is good bacteria and how do we get exposure to that?
Most bacteria are actually in the good category. So it's just the few that are pathogens, and those are the ones that cause harm. So if you, for example, go for a walk in the park or into a wooded area, you're breathing in all sorts of bacteria which are very, very good for your microbiome. So you've probably heard quite a lot of talk about how we should make sure that our insides are healthy, our microbiome's healthy. And we can do that by going outside, engaging in activities, and then when we come in, just wash our hands to make sure that we're not bringing any pathogens in and we're not ingesting any pathogens. That's the most important thing.
Okay, really clear guidance there, Dr. Lisa Ackerley. Thank you very much for joining us. Thank you.